Hey, how's it going?
Hi,
Hey,
good
Sharon.
evening, everyone. My name is Sharon Moreno. I'm a family nurse practitioner, and we have my super awesome co-host, Ray Martinez. Hi, Ray. How are you?
Great. I'm doing awesome. Had a wonderful day. How about you?
Good. Very productive as usual. I can't complain.
There you go. There you go. Well, great. Great. Oh, man. I tell you, Sharon, we're going to have a great show today. Este, so what was I going to say? Oh, man.
Uh-oh.
No. But
Some
it's
vitamin
cool.
B12.
We're last week we did the show with vitamin B12. And again, guys, welcome to the Gold Rush Health Solution with Sharon Moreno, and of course, and myself. Where we dig deep into the issues that truly matter to your body, your health, your mind, the overall being. So it's a journey we're going to take together, and Sharon's going to give us some wonderful answers. And she's really passionate advocate for health, healing, and hope. Today's episode, guys, is especially important because we're going to talk about something that affects millions, but is still more often understood. It's depression, guys. This isn't just a medical health concern. It's a whole body issue that impacts your sleep, your appetite, your energy, relationships, and even physical health. So here's the good news, guys. There is a way out of it. There's a way to move forward. We're going to explore practical, everyday things that you can do to stay tuned to the tide. It's the simple steps that you can help you lift you out of this fog and bring the light back into your life. Whether you're struggling yourself or supporting somebody who is. And, I think all of us know at least one person or somebody, or maybe a couple. I hope not a couple, but at least one person. Or you see people out there that, man, these people are pobrecitos, they're in depression. So we're not alone, and you're not alone. And today's conversation is especially for you guys. So, Sharon, take it away.
Absolutely. So we'll start with the legal disclaimer here, like we always do. And again, I want to know what topics interest you. I want to cater to the public. So if there's a particular medical topic that interests you, please put in the comments. I'd like to cater to you. Again, I know I've mentioned before that May is Mental Health Awareness Month. Mental health is near and dear to my heart for a variety of reasons. I love statistics because it's a way of us viewing the reality of things. Um, and so I'd like to start with that. The first piece of statistics I'd like to provide is the leading cause of disability in the United States from people
Mm.
aged 15 to 45 years old is major depressive disorder, which is depression. That's really significant. So the main reason that people are being disabled and not able to work anymore is because of depression. Um, again, that tells you that this is a significant disease process. This is not something that should be taken lightly. The second piece of statistic is that out of all the people who have been diagnosed with depression, 50% of them are not receiving treatment. So you could
Wow.
probably imagine why a whole bunch of people are being disabled because they're not receiving treatment for this particular diagnosis. Think about people who have diabetes or high blood pressure and they don't receive treatment. These kind of illnesses don't subside on their own. They require treatment, especially on the severity, on the cases that are more severe. The third piece of information I'd like to provide is that there's one suicide that occurs every 11 minutes. Again, that's significant. That's one death too many. So when people are talking about perhaps taking their life, sometimes we need to think of it as not someone who's just uh, trying to seek attention. These things
Mm.
are very real. I've known people myself who have taken their lives, patients, military people, and
Mhm.
it's significant. Today we see them and tomorrow we don't. So we really need to tell loved ones, friends, and family, one, that we love them and care for them significantly, and two, we really need to be checking on people and make sure that people are doing okay.
Yeah, definitely.
So what
I think also depression. A lot of it. Military. You're in the military, and all these people that have they come in and tours and all that. They come messed up, and society does kind of clashes with them because maybe they don't agree with what's going on, around the world, and so, it's hard, and it's they're not where they were at with their brothers and sisters, where they knew they had a home. Or I think of the Rambo, in the movie Rambo, and he comes back and he says, man, I used to handle thousands and millions of dollars of equipment, and over here I can't even get a job, that kind of deal. And you feel sorry for these people that are like that. And and when we don't want to get into the politics part of it, but they have problems. They have problems, and it's really to no fault of them. It's just the way, the stuff they have to see and experiment. And man, I don't know, man. They're a whole different level that I don't know. And of course, you got everyday people that also suffer. Now, like you were saying in that other show, there's a whole bunch of young kids under 8 years old. You were saying, right? Under 8 years old?
15 to 45 is the disability part. 15 to 45 is what they're getting disabled for.
Okay.
So, people 15 years old, these are teenagers.
Yeah, bebitos, man. And you would think that these guys are in the happiest time of their life. What to and as a lot of this percentage of these kids, they're not really, as you would think, from broken homes in a way. Some of them are from wealthy families. Some of them are from well-to-do, mom pop in the house, that kind of deal. And I think a lot has to do with the bully system. Well, not that it's a system, but the whole culture of bullying. And it's like, there's been a lot of cases where you find out, well, even look what happened in Uvalde, man. It all was because of bullying. And this guy gets his rifle and he goes in there and he shoots 19 kids, 19 kids and 2 teachers or something. And it's all that could have been prevented, but obviously it wasn't. And it got worse and worse. Depression, you keep it inside, and you gotta let it out. But unfortunately, when you're in depression, you're into yourself, and I don't know.
Yeah, bullying is a big issue. People find ways to do that, whether it's through social media, a lot of, just negative talk, in person. In my days, there wasn't a lot of big social media stuff. So it was a lot
Yeah.
of face-to-face stuff. But nowadays, there's a lot of social media posts and negativity, and that can just create a lot of harm to people. And unfortunately, if people don't have effective coping mechanisms and great support systems, it can lead things to self-harm or even suicide. So it can be devastating to people. So I tend to take these kind of things seriously when patients are telling me
Yeah.
these things.
Wow. No. It's so true. So yeah. So man, depression. Now you see it. You see it in your field, I'm sure. I mean, I know you're not a psychiatrist, or you deal with the mental experts. I think you see
Sure.
you see them out there before they get treated, and so you're able to, I guess, label it or identify it, and hopefully you can help them at that point. But at least you're able to say, oh, or ding 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 ding, this person is headed for depression or major depression, or is already in depression, and you're just going to take care of them from their health, or from their, for whatever they need health wise. But what's it like, going in there like that?
So most psychiatrists usually don't deal with basic depression. They usually deal with more resistant
Hmm.
depression that's resistant to treatment, and bipolar and schizophrenia and those kind of diagnoses. Things like depression and anxiety are treated by primary healthcare providers like myself. So I
Wow.
see it all the time. It's extremely common. I treat it a lot. The thing is that there's a big stigma with mental health. People don't like the labels of I'm crazy. there's something wrong with me. And so the issue is that sometimes people are a little hesitant to speak up, like, oh, it's just my nerves, or, I'm a little bit, on the, I get sad sometimes, or, so I have to kind of dig a little bit and help them with certain tools and questionnaires to really dig and help them. And even when I say, I think that you may have this, then sometimes they're like, no, 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 I don't want any treatment. So again, there's a lot of negative stigma associated with this diagnosis. People just associate depression with I'm crazy.
Yeah, yeah,
And so
makes
there's
sense.
a lot of education that has to be done and given to, but it's very, very common. A lot of people suffer from this. Uh, some people, a lot of people suffer in silence. But the people who do elect treatments, I do offer it to them and make it easy and convenient to them, so that they're not having to wait long hours to see me. They're getting the treatments that they needed, um, and so forth. It's again, mental health is a big passion of mine. Again, for these statistics that I mentioned, there's a big lack of treatment and interest. For one, we don't have a lot
Hmm.
of psychiatrists here in the Valley.
Right.
And so that's kind of somewhat the issue. But again, mental health is one of those diagnoses that takes a bit of time, and in the offices, a lot of primary care providers don't have a lot of time to sit and ask a bunch of questions. And so that's somewhat the issue. It's kind of like upper respiratory, here's an injection, and you're on your way. And mental health requires a lot of questions. Are you eating? Are you sleeping? Are you crying? Just a bunch of questions and time, because when someone's sad and not feeling well, mental health wise, and they don't necessarily have a relationship with you, provide a relationship with you, then they're not likely to be like, my life sucks, I hate everything, and just divulge this stuff to you. It takes them a while to, be feel a little bit more confident and give you this information. So it may take a few visits, it may take an extended visit, it may take you sitting down one to one and just digging a little bit to get this
Hmm.
information.
Yeah, and the thing I think is education, because I mean, if you're assuming that they're crazy, when you're in depression, you're not crazy. You're not crazy. That's totally a different thing than being crazy. So it's just, I think, lack of education, and they don't understand that, hey, you're not crazy. It's okay. Maybe you got your depression, we could take care of it, but you're not crazy. And I think it's just a
Absolutely.
little bit of embarrassment, and just feeling like, well, I think the statement that if they accept that they are in depression, or they think that maybe they're crazy, or they think that people think that they're crazy, that's kind of like another nail to the depression uh, thing, and so they can't deal with that. And so, yeah, that makes sense. Pobrecitos,
Yeah,
and
it's a tough place. It's a tough illness because this is not one of those illnesses that's black and white. Sometimes it requires um, multiple tries. There's not labs that we can just get like diabetes. Oh, your sugars are this numbers. Okay, let's increase or change the medication. With this, there's really no labs to get. We can't check neurotransmitter levels. It's kind of like a trial and error. Let's try this medication, see how you do. And then it
Mhm.
takes a while for the medications to work, to have therapeutic effects.
Yeah.
And then they have some side effects that are not necessarily exciting, and only the patient can decide, okay, am I willing to uh, accept these side effects to feel better or not? So there's a variety of things that can affect, if patients decide to take treatment or not. So
Wow.
it's a rather
That's cool.
complex disease process.
Hmm. Yeah. And how can we help them? How can we, first of all, I think, how can we identify it, and maybe how can we help them? Because
So
everyday life, we I think I know a couple of people that have depression, but I'm not sure. I'm not a
sure.
expert or psychologist
I think
or.
those are valid. I think those are valid questions. I love PowerPoints, so I prepared a PowerPoint so that we can talk about
Cool.
some things having to do with depression. So I guess we'll start there.
There you go. Gold Rush
Yeah.
has the solutions.
Yes. So let's talk about what is depression. It's a mood disorder that causes a persistent feeling of sadness and loss of interest. It affects how we feel, think, and behave and can lead to a variety of emotional and physical problems. It's more than just a bout of the blues and isn't a weakness that you can simply snap out of. You may have trouble doing normal day-to-day activities and feel like life isn't worth living. So just
Mhm.
listening to these kind of things, you can tell that that's significant. So it's not just, oh, I feel sad for a little bit and it's something that you can get over. So these are significant, these are deep, deep, you know, it's feeling sad times 1,000. It's a lack of interest times 1,000. It's having trouble doing normal activities, like just even getting out of bed, is a struggle. Some people may even feel like their life, they have like no vitality in their life, that there's no reason to exist, nothing to wake up to look forward to. So just imagine kind of feeling in that situation. And this is what these people have to live in and day out. So it really is significant. It's not just oh, I feel a little sad today. I feel sad times 10,000. I mean, it's a mega sadness.
Yeah, yeah, yeah. Wow.
So we talk about some symptoms of depression. There's a lot of symptoms of depression. Again,
Hmm.
they're extreme. We have things like feelings of sadness, tearfulness, emptiness, or hopelessness, angry outbursts, irritability, anxiety, restlessness, or frustration, even over small matters, loss of interest or pleasure in most or all normal activities such as sex, hobbies, or sports, sleep disturbances such as sleeping too much or not sleeping enough, tiredness and lack of energy where even small tasks are a major effort, altered appetite where the individual may have increased cravings and eat a bunch, or they may not eat at all. So again,
Hmm.
just looking at these few symptoms here, they're significant. We have again talking about sadness. That's sadness times you know 10,000. You have somebody who could be tearful, crying a bunch, and it could be for no reason. It could just be randomly
Yeah,
feeling.
yeah,
They feel empty. They feel they have no hope. They have no reason to get up and exist. They could randomly become angry, they're irritable. So any little thing like ticks them off. They could
yeah,
become anxious, again, for no particular reason. They just become jittery, um, restless. They become frustrated, even over small matters. So something where, they miss their bus is like, well, I miss my bus. I'll just call my parents. For somebody with depression, it's like a huge, huge problem, and they'll
hmm,
make a huge deal out of, and they'll make a huge deal out of it.
yeah, yeah.
We're
Yeah.
talking
So
about loss of, go ahead.
go ahead. No, go ahead. Well, I was just gonna say, it's so depression is more than just feeling sad. It's often deeper, heavier, and harder to, a person with depression, like for instance, might feel emotionally drained and numb. Like you can't feel joy, excitement, or any, even sadness fully, I guess. But they're overwhelmed by daily tasks. Like you're saying,
Yes,
even the smallest of things, or like brushing your teeth, or getting out of bed can feel almost impossible. Man, that would be hard. The hopelessness. They may believe nothing will ever change, and oh man, like imagine being in a position where you already know that nothing's ever going to change, so why even try? I guess that's where you think, why even try? So I guess that's why they stay, like they say, like in the comfort zone, in a sense. The isolation and or being felt misunderstood. I think I see that, where I see some people that I think might be under depression. But I think the main thing is also the guilt and being ashamed of maybe something happened in the past, or thinking that they're a burden. I know, like my in my parents' generation, my mom sometimes, she says, can we go here like next week or something? I said, sure, mom, just give me a call. And she goes, well, it's because I don't want to bug you. And I go, no, bug me, call me. If I can't do it, I can't do it, but call me. Let's take you wherever you want to go. But it's not that she has depression, but I think it's part of the culture like that. They don't want to assume, I don't know, just getting people's, I guess, ask people for help or whatever. I don't know.
The issue is that, you mentioned something that was, you made a good point. You talked about brushing your teeth. A lot of people that I see with mental health problems, their physical appearance doesn't, their hair isn't combed, maybe, their teeth aren't brushed. Again, because that requires a certain level of energy that they don't have. Again,
Wow.
I mentioned just getting out of bed is a task and a burden for them, because they lack energy. And so just existing is a big, big task for them.
I
And
bet
so
even
just,
preparing food would be a problem.
oh, yes. Oh,
So they
yes.
don't
That's
eat. I guess they lose weight, that kind of deal. They become, I guess, I don't know what's the word, but they become
like
weak.
anorexic thin. Yes, weak. Yes.
Yeah. Hey,
Mhm. Yes.
we got Christina, and who else is over here? Hey,
Let's see
Christina,
here.
how's it going?
She puts, thank you for this information, gorgeous. You're very welcome. Christina
Ooh,
has followed me with every show I've done. So thank you, Christina. I
yeah,
appreciate you so very much. Diola's another one. Hi, Diola. She also has followed me on all three
yeah,
shows. Thank you. I appreciate you so very much.
yeah.
Um,
I think
yeah,
Christina was
so
saying it's a bad situation to be in. Can you say it's a bad situation to be in, specifically when you have people that get you to that point because of the way they treat you or they treat us and think they are better than us. Oh yeah. I think
she's talking about, yes.
in relationships that happens, it's the que se, uh and then she put another, and thank you for watching us on YouTube, guys. If you're watching us on YouTube, definitely subscribe and let's grow the channel. Let's increase the numbers in there. They say, I can't talk or can't thank you enough for helping me through my depression as well. Hey,
I'm honored. I have, again, such great patients that are very grateful. Uh, this is a really, when patients come to me and they say, hey, I need help in this aspect, especially depression, it's a really tough area
yeah,
to be vulnerable with. And so when people trust me with this area of their health, I'm really honored and humbled that they do, um, again, because it's a really big issue. But I always say, hey, there's definitely light at the end of the tunnel, and I'll do whatever I absolutely can do to make changes in people's lives.
yeah.
um and when there's changes, then I have people who are so very grateful. So thank you for trusting me with your health. I'm honored.
Cool, cool, cool. Yeah, I know from like a non-medical point of view, like for instance with myself, I talk to a lot of people, and so my biggest thing in helping somebody like this, which I have, it would be just to listen,
Yes.
and provide a space where whenever they're ready to talk and open up, they're going to, because I part of it has to be with bringing out the past and dealing with the past so that they can move into the amazing future that they have, because they have an amazing future, but they're stuck in that position, they're stuck on that, in that depression, which comes from issues from the past. And and so I think that if you have a friend out there that is going through depression or something, I think the biggest thing that we can help is to definitely be present and not pushy. Just sit with them without judgment or advice. Just without judgment or advice, just that alone can heal it. Say stuff like, I'm here for you. I don't know, I don't have to go. You don't have to go through this alone. you know,
Absolutely.
validate their feelings, avoid saying cheer up and it's all in your head, stuff like that. Of course I guess it's not that I want to say it's in their head, but it is in their heads, it's in their system, it's what they feel, it's in their heart, and you can't dismiss it. You can't say, oh, orale, get off it, whatever. You have to meet them where they're at, and kind of even get into their world before they can come out of it. It makes sense that you're feeling this way. I know it's hard, you know. Pero I think encouragement with small steps, offer to do things with them, like taking them for a walk, cooking a meal together. I mean, going to the doctor's appointments, because they tend not to do that. They
Yes,
tend to skip doctor's appointments a lot?
they do. They do. Fear of, there's bad news. I don't want to hear anything bad. Yes, absolutely they do. So I tend to have to be the one to be like, hey, how are you doing? Just checking in on you. So
Yeah,
yes, they do. They tend to
and
do
I
so.
think that's the other thing, is just be consistent, keep checking in, even if they push you away. And don't respond at first. The persistence sends them a clear message that, hey, no, no, you matter. I won't give up on you. That kind of deal. I mean, from
Absolutely,
from that
yes.
from that point of view, because I mean, you're their friend, but they're your friend like at a distance. So, and always encourage professional help. And they get them to talk to Sharon, or
Absolutely,
get them
yes.
to talk to some psychologist or somebody. Because otherwise they're going to be in the same boat, and they're your friend, they're your family, they're your somebody that that you care about, you love. And so uh you know uh, that's how we can help them, that kind of deal. Somebody else came in there.
Yep. All right. So Media says, hi Sharon, this information is very helpful and true because I have family member that has depression, anxiety, and we have come a
Mm,
long way with counseling and being there every step of the way.
yeah.
Again, yes, this is absolutely the way, you have to be supportive. This is not an easy diagnosis. And what
No.
I do need to mention is it's not only tough for the patient, but it's tough for the family members and the loved ones.
Yeah.
Family members, spouse, girlfriend, boyfriend, a significant other. It's really tough for those people because these these patients are ill. They look fine, but they really are in a bad place. And to be that supportive person, it's not easy. It's a really tough place. It's like it's sometimes it's even harder for the loved one to be that supportive person because one second they're great and I love you, and the next second they're exploding and I hate you and go away. And so it's a really tough place for the family member and loved one to be there. So the only thing that you really can do is try to be as supportive as possible and just
Hmm.
be understanding. But yes, Media, thank you. That's a great comment.
Yeah, yeah. No, it's true. Let's move on to the next point there.
Sure. So we
Let's
talked
see.
about these symptoms here, and there's symptoms continue. There's a bunch of symptoms
Oh,
associated with
okay.
depression, a lot of them, and none of them are great. So the next ones we have here are wanting to stay at home rather than going out to socialize or doing new
Hmm.
things,
Hmm.
slow thinking, speaking, or body movements, feelings of worthlessness or guilt, and or fixating on past failures or self-blame, trouble
Right.
thinking, concentrating, making decisions, and remembering things, thoughts of death or suicide attempts,
Mm.
unexplained physical problems such as back pain or headaches. So again, we continue with devastating things. We have people who are becoming reclusive. They just want to stay home. They want to stay away from people. They don't want to try any new things. They want to stay away from people. They don't have the energy to be around people. That's very taxing. Slow thinking, speaking, or body movements. They kind of like in slow motion, just out of it. Feelings of worthlessness. They don't feel that they have any value. They don't think that they add anything. So that's also likely a reason why they don't want to be around people. They may not do as well as they should at work. Some of them function, but if they didn't have this depression, they probably would do much better. um, Trouble thinking and concentrating again because their mind is always in a place where they're fixating on their life. My life is terrible, it sucks, I just wish things were better. Even thoughts of death or suicide. unexplained physical problems. Some people have like psychosomatic things, where they
Mm,
begin having back pains, headaches, nausea, stomach problems. So these are people who frequently come into the, see me and be like, you know what, I have a lot of nausea. My stomach hurts. So, when I have patients that come to see me frequently complaining of random things and I do workups and I don't find anything wrong, then I tend
mm-hmm.
to think that maybe they have some mental health related issues going on because I don't find a medical cause for their symptoms. And remember, the brain controls your
Right.
body. And so if your brain is ill, then your body soon will follow then after. So again, it's a big issue. If your brain is not well, then you're going to be ill. You just won't feel well. It's just a big lack of vitality.
Yeah, yeah, that makes a lot of sense. It's like they lose interest in life. They no hobbies they once loved feel boring and meaningless. They might cancel plans, avoid family, and stop engaging in church, work, and community activities. So it's like extreme fatigue is another one. I mean, that's what I'm hearing
Yes,
from you.
yes.
The feeling of worthlessness and self-hate. Oh man, self-hate. Powerful that's a powerful word right there. I'm not good enough. I'm a burden. No one would miss me if I even disappeared. Uh, I mean, I don't know. Maybe even the way we think. I mean, overthinking, and I guess that's where anxiety comes in. Uh, or the constant thoughts of failure. Past regrets, the fear of about the future, what's going to happen in the future. So wow, it's there's a lot of things here,
A lot of
that
negative
that,
things. And
that
remember
come into play.
that the majority, remember we talked about the leading cause of disability is depression. So,
Hmm.
I've had people park in disabled parking lots, they have their placard and they park in these places. And well, they physically may look fine, but clearly with all these symptoms or some of these symptoms, they clearly are not fine. And then,
Right.
you have people kind of like screaming at them like, hey, why are you parking there? You're not crippled. You look fine. And so that's kind of the issue is that, again, these people are kind of like disabled incognito because they physically look fine. They're not missing legs, they're not on crutches or
Right.
anything, but they clearly are not fine with, these symptoms that we've listed. They're in a really bad place, actually.
Mm. You know what you mentioned the handicap, and I know this is off the subject, but this question just popped into my mind because I see it. I go to the hospital in Harlingen, and there at the Medical Arts Pavilion because I do some chess lessons for some of the doctors' kids there, and so when they have a long row of handicapped parking spaces, but mainly they all most of them say physically, or it has to do with physical that you can't physically walk or something like that. So my question is this: is and can anybody with a handicap sticker park in one of those parking spaces, but that person can walk? In other words, if I have, like, for instance, my mom has a sticker, so when I take her around, I can park in a handicap space, but I never park when it's for ramp or when it's for physically able. Is that correct?
I'll be honest, I've never seen that there's that designation. I
Mm-hmm.
understood, what I understood was the handicap was for the handicap, because again, and I may be wrong, I've only seen just handicap period, just the wheelchair insignia. And
Yeah.
so the understanding was if you have a placard, which is that either it's a blue one or a red one, the red one is like temporary because some people can have, let's say, a surgery. And so
Mm-hmm. Mm-hmm.
they're going
Yeah,
to
for a
be
little bit.
temporarily handicapped. Uh-huh. And then the blue one is like a permanent thing. As long as you have that placard that you hang there, regardless of what the handicap is, you can park there. I've never seen an area
Well,
that says only
even
physical
HEB will
handicap.
have HEB has some that's it for their ramp. Like for they have the thing, the parking space that's painted. So obviously, a car that's not going to use a ramp should not park there, even though they're handicapped. Yeah, and that's my understanding. But at the hospital, it actually says if you're physically challenged, or I don't know how it says, but it has to do that if you can't physically walk, you can park there. Otherwise, you cannot.
I'll be honest, take a picture next time you're there. I've
Yeah,
not seen
yeah,
that. I've
yeah,
just seen just the wheelchair insignia, and which means handicap. And so you can park there if you have the
yeah,
placard. If
yeah,
you don't have a placard and you park there, you're in big trouble.
yeah, yeah,
They'll
yeah,
come and give
yeah.
you a ticket and fine you.
In fact, sometimes, even though I can park with it, I don't use it. I don't use it. Uh, but I again, you can't judge because sometimes people park and then they come out and they're like, "Woo, doo, 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 doo," and I don't know. But I will say this, and if you own a handicap sticker and you own the handicap sticker because you either are a provider or maybe you help somebody like a mom or a grandma or some family relative. If that person's not in the car, please do not use the handicap sticker
Yes.
because it doesn't belong to you. It's not for you, rather. Because other people can use it.
Yes. Yes, that's correct. That's the way it should be. That in that case, that placard should be used only when the person
Hmm.
who it belongs to is in the vehicle. Yes, that's
Well, I just throw that out there because you mentioned it and it triggered me to ask that question. But I'll remember to take a picture of it and send it to you so that you can,
okay. Yeah,
because
I'm
I
serious
think,
now.
stuff like that, people might not know. And so I don't, in fact, I actually saw somebody parking one of those and then pulled out and drive and park a little further. So I don't know.
I mean, when in doubt, I think it's better safe than sorry. That's kind of what's
Yeah.
important. I wouldn't want to get a ticket, but because I know that they take care of those parking areas, but I really don't know.
No.
I can't park in the
Anyway,
areas anyway. I don't have one of those placards.
no, no, you don't. You're in such great health that no, it wouldn't work. Alright, what's next? Which is the
All
next
right.
point?
So we have some
The
treatments.
treatment.
We have some treatments for depression. So, of course, I'm, clinical and we talk about medications, but medications and psychotherapy are effective for most people, but some may require other treatments. Some common treatments include drugs like pills like SSRIs. Examples
Mm.
include Zoloft, Lexapro, SNRIs, and these are like the categories of the medications, venlafaxine and Cymbalta, atypical antidepressants like Wellbutrin and mirtazapine, TCAs like amitriptyline and doxepin. These are kind of just like some examples of the more common treatments that we give for depression. You go and the doctor or medical provider says, you know what, yes, I believe you have depression. I believe you would benefit from treatment because not everybody that has depression, either one would benefit from treatment or two will agree to treatment. But if one, they would benefit from treatment and the patient says, yes, I'm agreeing to treatment, then these are some of the medications most commonly prescribed for depression. Now, again, these medications, in about 2 weeks, we'll know more or less what side effects they'll be having. In 4 to 6 weeks, we have maximum benefits. I always recommend that if patient is depressed, that they should be on these medications long term, meaning for about 2 years. No one should be in a hurry to get off medication, especially if the symptoms that they're having are devastating and are multiple, like the ones that we mentioned. And they should never just be removed off the medication. They should be weaned off the medication. So some people be like, oh, I feel great. Let me just stop the medication. That's really not how it works. They're likely feeling well because the medication is helping
Mm-hmm.
level out the neurotransmitters. That's how these medications work. And if you just stop them, then you're going to have the neurotransmitters be back to being dysregulated, and then now you're going to have, back to what you were feeling before, plus withdrawals from the medication. So we try not to. I always try to tell patients that they need not to do that. That needs to be regulated by a healthcare provider.
All
But
right.
once you start feeling,
Yeah. And all of these pills are prescribed, right? They're not over the counter type of
that's
deal.
correct. Yes, that's correct. That is correct. Yes, none of this is over the counter stuff. These are all prescription medications. They have to be followed by a healthcare provider. Depending on how severe the depression is, there's a black box warning on these medications that suicide is a risk, and not because the medications cause suicide, but simply because the patient is feeling ill, has little energy, and as they start to feel better and have just a little bit more energy, they may be like, wow, my life really sucks. And they have just enough energy to perhaps commit suicide. And so that's the reality of things. So it's not really the medication causing that. It's that the medication is actually working for them and they're actually feeling just a little bit better, but it's not better enough that they're out of the funk. It's just better enough to realize, wow, my life is not great. It sucks. And I don't want to be here. And now I have enough energy to actually do something to get me
Yeah.
out of this problem. And suicide is one of those contemplations.
And I think this is where it comes that you have to be in your friend's lifeline. You have text, call, checking regularly, even a simple "Hey, just thinking about you today." Help them remind them that hey, they matter. Just being consistent. And I think another thing that can happen along with what Sharon saying here is educate yourself about depression. Este, uh, learn what it is and what's not what it's not, knowing the signs and symptoms, at least to a little bit. And I put a little thing here on the comment section. If you can give us a little bit more on this, um, the NAMI.org. Do you know that?
No, I'm not familiar with that. What does that stand for?
Well, I picked it up. But let me MA here. Let me boom boom boom. And what it is speak out and speak up and give us, and I mean give help, give hope, and it's Mental Awareness Month, but it talks about everything happen that's going on. I guess it's the National Alliance for Mental Illness. That's what it
Okay.
means. That's the nation's largest grassroots mental health organization in the United States, and uh, uh, I mean, there that it's got you can find support and get involved, advocates for change and the whole bit, and so uh, most of the uh, there's people that help you that have gone through this or or been involved in it for some. I don't
Sure.
know. It's just out there. It was out there, so I figured maybe
So
you
resource.
knew a
Okay.
little about resources. I don't know. I mean, you can't go wrong, But the thing is, you have a friend. You need to, get some help. You need to in educate yourself and that kind of deal. And of course, talk to Sharon or talk to some other medical profession, like psychologist or whatever, counselor, whatever it is that you have access to. But I think the best thing you could do is just be that person's friend, and you know. And I think too is like, man, if you get involved in a relationship like that, and I'm not talking about love relationship, but just a friendly relationship with somebody like that, you need to be responsible and you need to have some grit. You need to have some ganas to want to be that friends, because if you're going to commit to uh being a friend to a person like this, uh you might be the only connection that person has to get to a better life. And if you mess it up, they'll crash. I don't know. What do you,
Absolutely. I
right?
agree. I think being supportive of people with mental health is extremely important. Sometimes you have no idea how valuable you are to someone. Um, that's I think that's a really important statement there. Support is extremely important. Sometimes just a good morning text, sometimes just a good night text. Hey, are you okay? Those things, are really valuable. And sometimes people take that for granted. They don't realize that those things are really important. Just feeling like you have someone that you can talk to and trust is invaluable.
Yeah. Yeah. And I mean, because they'll drain you. Uh, and you got to be strong yourself. You got to be strong because uh, I've had some situations like that to where, oh man, they're constantly, either they're calling you or you're calling, but that's after a while because at the beginning they don't call, or at least that's what I've gotten, that they don't call. They don't call you back because you're the one calling you, because you know
Yeah.
whether they're your friends or not. I guess they don't trust you. uh I don't know if that makes sense, Sharon. I don't know.
It does. I think it just takes a while for people. Again, a lot of times it takes a while, even though they're your friends. Some people, may be your friend, but they may not feel comfortable sharing their deep and personal stuff.
There you go.
So, some people are very private with their personal life. And so that's kind of the issue. And I guess you just have to be respectful of that. You offer support, and if they decline it, well, you've offered it. You can't force something
Yeah.
upon someone, but you're like, hey, I noticed this, do you need something? Can I help you with something? No, 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 no. Okay, all right, fine. Well, thank you. Just know that I'm here, and just offer that. And, ultimately, if they feel safe, they'll come around. And if they don't, then they won't. We can't force people to take what they don't feel comfortable taking.
Yeah, yeah. That is so true. I agree.
All right. So we have our next slide, some common side effects associated
Oh
with
man.
these treatments that I talked about here. So again, if we have depression and we get treatments for it, some common side effects with those medications that we talked about are things like weight gain, decrease in sex drive or sexual dysfunction, like erectile dysfunction or problems with what do you call it? Well, I'm breaking the name,
with
whatever. I'll come
with
back to it.
with her little buddy. No.
Nausea,
Hmm.
nausea, drowsiness, dry mouth,
Mm.
headaches, constipation, or muscle twitching. And these muscle twitching can be permanent. They stay on the medication, then it can be permanent. People, have, like stuff with their fingers or, mouth stuff or stuff with their eyes. And so that's kind of the issue. So these side effects aren't necessarily exciting either, but only the patient can decide, you know what, I'm feeling bad enough that, yeah, because these side effects don't necessarily happen, although they are somewhat common. Um, but they can take the risk to say, okay, I'll take the medication, and maybe one of them will happen that aren't bad enough, or maybe none of them will happen. But whereas they already know that they're having those feelings for the depression, they're there already, and that's why they're seeking treatment. Versus, no, I'm not going to risk these side effects. I'm going to continue feeling the way I feel. So that's kind of the situation. That's kind of the situation that they would be in
Yeah.
as the patient.
Yeah, and I think, like, for instance, if one of somebody's your friend and maybe they like going to, whatever, maybe going to, say, Sonic and having a cheeseburger, they might all of a sudden not like the cheeseburgers from there, or they may like, prepared a different way, or they might altogether just decide, hey, no, I just want to eat hot dogs or whatever. And so uh, that that's that happens, like you're saying, the body aches and pains, headaches, back pain, So it's back pain, for instance. We a lot of times we get that because of the mattresses or whatever. And I just recently got a new mattress, and I feel so much. I'm sleeping so much better. But sometimes it's not a bad mattress. Sometimes it's just you know that but one of the things that surprises me, Sharon, is that it weakens the immune system. And they tend to get more colds and inflations and other illnesses. Tell,
Stress.
tell us about tell us about that. Yeah, how depression affects the immune system, because from there,
Sure.
man, especially nowadays, we're there's COVID, there's all these different things that we can get, and it all has to do with the immune system, right? But
So the issue is that the reason it can affect weaken your immune system is because remember, they may not be eating well, so they may be not intaking vitamins like they should.
mm,
They're stressing, they're thinking about negative things all the time. All this placing your body in a high stress position, poor oral intake, uh, you know, uh, places your body in a situation where opportunistic illnesses come and be like, oh, she's not doing so good. Well, let's attack her and, get her ill. And so, in order for
mm,
your body to be in a better place, you have to sleep well, you have to eat adequately, and you have to hydrate, take appropriate vitamins with your food intake. And it doesn't sound like people with depression are doing this. And so, it's so much easier for us to become ill with this particular diagnosis.
wow, that makes a lot of sense. You know. Well, man, we're close to an hour here. What else do we have? Huh.
So that's the end of the slide there. But what I do have is for people who think, how do I know if I have depression? What I use with my patients actually is something called the PHQ-9 scale. This is pretty easy to use. So if you think that this may be something that you have and you want to just do this in the privacy of your own home, you can answer these questions. So some questions, and there's four answers. The answer would be not at all, several days, more than half of the days, or nearly every day. And these are the questions. Little interest or pleasure in doing things.
Mm-hmm.
And this is over the last 2 weeks. This is the time frame we're looking at. So you got to think about the
Yeah.
last 2 weeks of your life. Feeling down, depressed, or hopeless, trouble falling or staying asleep or sleeping too much, feeling tired or having little energy, poor appetite or overeating, feeling bad about yourself or that you are a failure or have let yourself or your family down,
Mm.
trouble concentrating on things such as reading the newspaper or watching television, moving or speaking so slowly that other people could have noticed, or the opposite, being so fidgety or restless that you have been moving around a lot more than usual, thoughts that you would be better off dead or hurting yourself in some way.
Mm.
And the last one here is if you checked off any problems, how difficult have these problems made it for you to do your work, take care of things at home, or get along with other people? And
Wow.
so, once you do that questionnaire, then it gives you the score sheet here. And so the first set of scoring here for major depressive disorder says it suggested if of the 9 items, 5 or more are checked off at least more than half of the days. So you checked off at least 5 of them where it says more than half of the days, then it's major depressive disorder is suggested. If you checked off 1 or 2 of the items where it says at least more than half of the days, it also suggested. Now, if we look at treatment, thinking, okay, well, major depressive disorder or depression, I think I may have it based on this checklist here. Okay, we come down here for guide for interpreting the PHQ-9 scores. This looks at treatment here. Okay, I think I may have it. Would I or should I be a candidate for treatment? So we look at a score of 0 to 4, and this is the total score. Depression severity, none or minimal. So patient may not need depressive treatment. So if you score none or minimal, then you, depending on how you feel, how much quality of your life is being affected, you may not need treatment. If you have a score of 5 to 9, that's considered mild. Now, here we have to use clinical judgment about treatment based on patient's duration of symptoms and
Mm-hmm.
functional impairment. So it's going to pretty much give you that for mild and moderate.
Mm-hmm.
Moderately severe, then we start to talk about treat using antidepressants, psychotherapy, or a combination of treatment. And so, again, what I would recommend is if you think you may have depression, take this test in the comfort of your own home. And then, take that to your primary care provider and say, I don't know, but I've been feeling off. I think I may have depression. And I took this quiz at home and this is what I scored. What do you think would benefit me? Because I'm tired of feeling this way and I would like to feel better. And then the primary care provider can most definitely help you and guide you as to what you need. Again,
Mm.
remember that these symptoms are not, it's always best to go to your primary care provider because these symptoms don't always mean that you have depression. Some of these symptoms can be associated with other things like low thyroid and, other things that are going on. So only the primary care provider should be the one to sort things out. But this is kind of just a general tool to look at a possibility for depression.
Wow. No, pues that's true. Uh, wow. And it's amazing that, depression, I mean, it doesn't just make you sad. It can affect how you sleep, you eat, you think, you connect with the people you love. And so understanding these side effects helps us and helps you offer, the right support and, realize this is more than just a mood swing, Uh, you're not, what is it? Sometimes we make fun and we say bipolar or whatever, and it's like, or you're just moody. But it's a whole body, it's a whole life change challenge. Este, uh, so wow.
Yeah, this is definitely is not a mood swing.
Wow, man, this was a very informative, very strong topic, and man, I'm hoping that a lot of people will see this, and that we'll see it over and over again because, man, you gave us a lot of good points, uh, and this is something. I mean, you don't study, we don't know. Uh, we might have seen it in some of our family members, and we might have an idea, but we're not too sure, about it. Um, we might be calling it something else, oh, touchy flower or whatever. That's
Yeah.
the big one here, in our culture. Oh, touchy flower, that's so and so, whatever. Lazy, and so we need to make sure we're helping our family members and our friends out and not, putting them in a box that, where it's not really helping them. Este, but great. So, wow,
Yeah.
man, it's just about that hour. What else, Sharon? Any words? Any other things we need to talk about, or what do you think? Or do you have any more?
Um, I think it's important. Just understand that you're not alone. I'm always a text away. If you need anything, you can always text me. My patients know that. Mental health is important. If you feel that you're not being heard by whether it's your own provider or family members or whoever that is, you can always text me and ask me questions. If I don't treat you, I'm not going to charge you. Um, but whatever you need, I'm here to support you, and we'll be on next week with another topic. I didn't see any comments about topics. Don't worry, I'll take care of that. Um, but other than that, thank you for listening to me. I appreciate you guys, and we'll be here next week.
Yeah, yeah. So great. On behalf of myself and Sharon, thank you for joining us on Gold Rush Health Solutions. Until next time, guys, stay strong, stay hopeful, and keep moving forward one step at a time.